Hi, this is Akshata KP, postgraduate student from RV College of Nursing. Today we are here to talk about a very important topic, Parkinson's, especially to create awareness among the public. Hi. Today we have with us Dr. B.K.Madhusudhan, a distinguished neurologist, Aster RV Hospital. With over 17 years of clinical and academic experiences, he is a specialist in stroke management, epilepsy and comprehensive neurological care. He is also currently serving as a syndicate member of a prestigious Rajiv Gandhi University of Health Sciences. Sir, hi.
Hi.
Sir, what is Parkinson's in a simple terms?
See, Parkinson is a neurodegenerative disorder. What is neurodegeneration? As the age advances, the nerves are going to become weaker. Similarly, due to some pathological conditions, the nerves can become weaker fastly. So that means it is a Parkinson disease is a neurodegenerative disease caused by abnormal accumulation of some abnormal proteins, which leads to decrease in the production of the dopamine in the brain.
So can a young adult be affected with Parkinson's?
Definitely. See, what happens majority of the time, the Parkinson usually comes after the age of 55 or 60 years. And in a few patients, especially around 10 or 15% of the patients, sometimes it can be seen in young people also. Usually 10% of the people will get affected less than 50 years of age. So it may be because of various conditions. It may be because of the genetic factors. Like it can run in family, especially in those 10% of the patients who get less than 50 years. In them, 1% or 2% of the time there can be genetic cause. Not all these Parkinson disease are genetic. That genetic may be due to some autosomal dominant or autosomal recessive gene mutations which happens in the body.
Okay.
Yeah.
So, can you tell us the early signs and symptoms of this Parkinson's?
Yes, usually what happens, how you diagnose the Parkinson's disease. There are some 4 or 5 important symptoms what you should know. Like usually they come with the shaking of the hand, that is called tremors. That is called resting tremors. Whenever the patient is in rest, that time only you can see the tremors. That is called resting tremors. They can have rigidity of the limbs. Rigidity means what? Stiffness of the limbs. It is very difficult for them to move the limbs. Then comes bradykinesia. Bradykinesia means slowness of the movements. If they want to take one object, it will take more than a minute. So that is called slowness. Walking will be slow, doing the daily activities will be slow, talking will be slow. Then comes the coordination. They will not have much coordination in the body. And they also have imbalance. That is called unsteadiness of the gait. Whenever they walk very slowly. That is called festinant gait. And there will be unsteadiness. They are not able to balance themselves properly. Whenever they turn, they may feel like falling also. So these are all the important features of Parkinson's disease. And before these symptoms appear, sometimes they can also present with loss of smell sensation. That is a very, very early feature. And then some people will have the shoulder pains. They may come with frozen shoulder. Some people will have constipation. This may be the other features which will be noticed in early stages of Parkinson's disease.
So is it a psychiatric disorder?
See, it is definitely not a psychiatric disorder. It is purely a neurological disorder. What is psychiatric means what? Everything should be normal, right? But here the neurological condition, that means in the brain there is the production of an abnormal protein called synuclein, which will go and accumulate in a brain area called substantia nigra. That is the area where the dopamine production will happen. Like insulin will produce in the pancreas. If insulin is not produced, they will get diabetes. Similarly, if dopamine is not produced in the substantia nigra, they will develop Parkinson's disease. And this dopamine chemical has to go and act on the basal ganglia. Then only our hands, everything will be free, and fine movements, everything happens because of the action signals from the basal ganglia. So when dopamine production only is not there, the basal ganglia function will be affected, and the hand movements and fine coordination movements, everything will get affected. It is basically purely a neurological disorder. But in some times they can also have depression. Many of the neurological disorders also will have depression. That doesn't mean that everything is psychiatric. This is a neurological condition and it has to be treated by a neurologist.
So how can we differentiate about this Parkinson's mask phase and like depression?
Correct. See, majority of the patient with Parkinson's disease will have masked phase. That means expressionless phase. This expressionless phase can also be seen in patient with depression, but they will have all the other features what I told you. So all the other features when it is there and masked face is there, that is Parkinson's disease, and you should not treat it like depression. You should always see all the other cardinal signs and symptoms which is there. If it is there, then you should treat it like a Parkinson's disease.
So is it completely...
Depression patient can cry, smile and all. But Parkinson's patient, it is very difficult.
Like a blunt effect.
Yes.
Is Parkinson's completely treatable?
See, it is not completely, you can't reverse the disease, but definitely you can prolong the disease, right? That means there are a lot of medications which can facilitate the disease, means facilitate the movements of the patient. See, there is something called, in this disease, patient will be slow, but what you can do, you can make him fast. That itself is a treatment, right? So, if a patient finds difficulty in doing his daily activities, and if you are making him to do all these daily activities, that is a treatment. So that means there is a lot of medications which are available, especially dopamine agonists are available, and MAO-B inhibitors are available. Very new drugs are now coming into the market, and there are a lot of alternative medications also available. And along with this, we have to give them the other therapies also. Only medicines will not work. Many of the time these medicines will work for these symptoms, but they have to go for the rehabilitation also. That means physiotherapy, gait balance, walking, all those things has to be taught to the patient. Along with that, there are other options like surgical options are also available.
So can we know about the surgical options?
Yes, see, all the patients may not be suitable for the surgery. But there is some patients where certain criteria are fulfilled. In those patients, we can do a surgery called deep brain stimulation. In deep brain stimulation, what we do, we put an electrode into that region, especially subthalamic nucleus or globus pallidus interna, and from there we attach one battery to the chest. So usually we adjust that battery in such a way that whenever that electrodes are stimulated, signals are going to the brain, your hands and legs are going to become free. That means it will become looser, otherwise it will be rigid. So here what happens, this surgery is successful in many of the patients and it can change the lifestyle of that patient.
So is it available here or where?
Yes, DBS surgery is available in our Aster Hospital, and our neurosurgical neurosciences chief is one of the specialized person in doing this type of surgeries. So they do DBS quite often in our hospital. Every month we do around 4 or 5 DBS surgeries in our hospital.
So are drugs available at Jan Aushadhi Kendra for a cheaper rates?
Yes, few of the drugs, not all the drugs are available, but few of the drugs are available. Some of the basic drugs are available in the common pharmacies also.
Sir, any yoga forms which helps in slowing down this progress?
Definitely. See, as I told you, now we have to practice all the integrated medicine. Earlier, only allopathy, only homeopathy, only Ayurveda. It's not like that. Whatever is good in all the fields, you have to take some few things. Similarly, here, the naturopathy. Yoga means what? Nature curing, right? Yoga exercises, it is like physiotherapy. So these things are definitely going to help the patient. They are going to help the patient to make them calm. And it has been proved in many of the experiments that cycling, that static cycle, what we do in the gym, that itself will release the dopamine in the brain and make the patient little free. So these are some of the things which you should utilize, and definitely these things are going to help the patient.
Sir, as Indian families will ask about home remedies. Can you suggest some home remedies? Are there?
See, as I told you, the cycling is a home remedy. Eat fruits, eat vegetables. They are rich in antioxidants. See why these process and outcomes, degeneration in the brain happens, why? It's all because of the process called as oxidative stress, which happens in the brain. There are some free radicals which releases in the brain, which are going to act on the brain cells and it is going to damage the brain cells. How we are going to reduce that oxidative stress is naturally by eating all these things. See, our fruits, vegetables, all these are very rich in antioxidants. These antioxidants, if you consume, it's going to reduce the oxidative stress. That itself is a home remedy.
So can we talk about some follow-up cares or follow-up visits?
Definitely. See, usually once the patient diagnosed as Parkinson's disease, they should be under follow-up for at least once in 3 months or 6 months, they should be under follow-up. Why they should be under follow-up means one is reassurance. If there is any change in the medications, we have to change. or any adjustments, dose adjustments required in that patient, we have to adjust the dose. So, or any new issues if it arises, whether it is neurological or some other features, non-motor symptoms which are arising in the patient, those things has to be addressed. And reassurance is very important, especially the caretaker who takes care of the patient. Their role is very, very important. We have to give that much of reassurance to the patient, also to the caregiver.
So as we are coming to the end of this wonderful conversation, takeaway message to our public.
See, the message to the public is, first you should know what is Parkinson's disease. Many people will not know that they are suffering from Parkinson's disease. If at all, if they see any patient with shaking of the hands, walking very slowly, or if they are having falls, repeated falls, if they are not able to turn properly when they are walking, they should consult a neurologist at the earliest, because early diagnosis and early treatment means early cure, or at least you can prevent further progression of the disease. So I think this is the best treatment. Early diagnosis, early treatment is best always in all the diseases, and it applies to Parkinson's disease also.
So it was very beautifully said. Thank you so much, doctor, for sharing your time and valuable insights. Thank you so much.
Thank you.